What to do when you are missing one tooth. Watch this video to the end and you will find out what methods and techniques exist to restore one tooth. And most importantly, you'll learn about the consequences that can occur if that tooth is not restored. Very often patients ask what to do when they are missing only one tooth. In fact, there is a lot of information on this subject on the internet. It would seem a huge dominance, and there is an understanding that this is already a fairly classic situation, but nevertheless these questions do not subside, specifically in our clinic, and patients personally write to me what to do when one tooth is missing. Therefore, I would like to tell you more about it. First of all, what does it affect when there is a missing tooth, and most importantly, how can it be replaced, compensated for, or restored? So the first thing I want to start with is, of course, what the missing tooth affects. Of course, like nature does not tolerate emptiness and just one missing tooth. It will definitely be compensated by our nature. This space will be compensated. So this is a very important point, and it definitely needs to be addressed. The first thing that happens with one missing tooth. More often we talk about a certain space or gap of one tooth. When we have teeth on each side, and in the middle, let's say there's a gap of one tooth. So what does this most often lead to? Definitely, our neighboring teeth start to shift. For some people, this process takes years. For others, it is quite a lightning fast form, like this, say, atrophy or compensation or decompensation. So, when the body tries to compensate for this defect on its own by shifting neighboring teeth, it will definitely have a detrimental effect later on for prosthetics. So the first point is, of course, shifting. The neighboring teeth, that is, they were completely parallel to each other, and the teeth start to, let's say, shift together because I emphasize nature tries to compensate for this defect. The second very important point is, of course, the so-called antagonist teeth, meaning the upper tooth more often. So when we talk about antagonists, we mean the teeth that should come into contact with each other. Yes, these are the antagonist teeth, and most often the antagonist tooth that doesn't see this support, or it simply doesn't exist. As a result, this tooth starts to elongate. It really begins to, let's say, increase in size. It starts to protrude, let's say from our own such a saddle and its place to which it originally stood. Here, the tooth begins to move forward, and accordingly we get such an elongation. Yes, it seems to be trying to fill that space, which is why the antagonist tooth starts to protrude. The second point is also very important. In such, let's say in the clinical case of a missing tooth, the first point is the protrusion of the antagonist tooth. And also the most common third point is, of course, bone atrophy. So, in the place where the tooth is missing, let's call it the gum, and most importantly, the bone underneath it, since the bone isn't being used. Let's put it this way, it's without any load. And right at this point we have atrophy, bone loss. The tissues, it's quite real, and patients notice this too. So this space, this indentation, let's call it that, yes, this moon-shaped area, it becomes deeper and deeper. The patient also notices this. The roots or the necks of the neighboring teeth become exposed. This is especially visible when there is such recession and bone loss. So the sooner we, doctors, dentists, don't just say that this needs to be done for no reason. The sooner the better, not just for no reason, because I emphasize these processes are happening and they are irreversible. That's why it's very important to act promptly if we've noticed or lost a tooth. It happens and it's normal because, let's be honest, cavities are a common issue. Yes, it's the most common disease on the planet, so everyone suffers from it, which is why a tooth can be lost for various reasons. But as soon as we lose a tooth, we need to restore it in a short time. This is the defect, this is the missing tooth. Now we are gradually approaching the question of what methods there are. This is actually a common question. Right now, this was more of an informational session, but the question that patients most often ask is, what should I do? How can I replace the defect? What can I do? And they ask these questions, even though I emphasize, it seems like there's quite a bit of information and doctors talk about it, but still, the patient asks the same one. And the same question, what should I do? So there are three classic options for solving this problem. Option number one is the classic option that has been used for many years. These are what's called bridges or crowns. Let's say we place a crown on two adjacent teeth, And in the middle, we have a little bridge like this, which helps us restore that defect, so to speak. Missing teeth thanks to crowns, that is cows, she, as a rule, flying. So it's two crowns in the middle. Let's call it a little bridge or an empty tooth that we are replacing. That is, we have a support, and the supports are our adjacent teeth. Let's draw an analogy with a bridge, that is two banks and one in the middle. The bridge itself is not real. So this solution to the problem is quite traditional, still existing, a good option in principle. Especially now, metal ceramics are already a thing. What were some iron teeth? Now, of course, metal ceramics or zirconium. Therefore, the most real rules, let's say. So, a full solution to the problem can be done, so it is necessary. The main thing is to replace what is the big minus of modern dentistry is just a temporary examination, now more, for preserving teeth. Therefore, of course, the most painful thing for us, for our patients, or rather for us as doctors, is that unfortunately we will say so. We grind down two healthy, completely healthy adjacent teeth for the crowns that will be placed on them. And this, of course, is our pain, and we really don't want to do this. Unfortunately, back when implants weren't as widespread, even though they've been around for many years, actually, it wasn't as widespread in our country. And yes, in general, let's say, in major Russian cities. But now, of course, when we see crowns, we approach this already. At least to the patient, we explain what a crown is. So, with crowns, two adjacent teeth are ground down, and we place the crowns on them. Of course, this affects the durability of the structure. Of course, this affects the longevity of the supporting teeth themselves, and there are certain nuances. Of course, there are so-called technologies, and there are some doctors who can shape the tooth quite skillfully. It exists, but it's very rarely encountered. Most often we grind in the most classical way, say a very large amount of fabric, we remove the tooth. Therefore, the tooth is exposed, all the enamel is removed, the tooth is unprotected, it will never be restored to that tooth again. We are traumatizing it intentionally, and without this you can't escape. And the most important thing, sometimes not all doctors actually perform root canals on teeth, meaning that the teeth are completely healthy. We are literally killing them. We remove the nerve, which means, let's say, we mummify or kill that tooth. Then just so that, God forbid, the condition of the teeth or the crowns, or rather the teeth under these crowns, did not bother the patients. That's exactly why, unfortunately, the tooth. Root canals are also performed, but in most cases, of course, they are done on the adjacent teeth. These are the supporting teeth. They are killed, they are essentially dead, and this will also affect their future life and their further use. So, this is the biggest downside of this technology. But it does exist. It's absolutely normal. I emphasize if there isn't another option. Most often these are patients who are very afraid of implantation. And the second thing is that it just saves costs on that side, of course. So there is either savings, by the way, in such settlements. I myself worked in different regions, so to speak, of our country. Therefore, there are regions where implantation is not developed, and there is not even such a surgeon. Patients construct, replace with bridges. This is a normal approach. Why? But this main minus needs to be understood. As the second, this needs mentioning, and median prosthesis or butterfly prosthesis. This is also a good option. Some people forget about it. But by the way, even now in our clinic, I periodically see such patients coming in, both men and women. They need different approaches, but nevertheless, such patients do exist. It's a kind of prosthetic, a small removable prosthetic. It's called a butterfly because it moves like a butterfly, meaning it fits right in the middle of the tooth. This is most often a temporary solution, and that's very correct. No, some patients do this. It's a temporary solution to avoid the shifting of neighboring teeth. Yeah, you say it. We'll show it like this, right? And the opposing teeth. So this is a good, complete, cool, temporary solution to stop all these processes. So this kind of process happens quite often. This happens with the patient when it's temporary. By the way, this is also a very important point. Relevance, or let's say the urgency of addressing this problem often depends solely on the location of the defect. What does this mean? Does it mean if it is when it is in the smile line, let's say then either in the smile zone or in the visibility zone? When we smile, it's noticeable. Of course, patients address this problem much faster, almost instantly. As soon as a tooth isn't visible, like in the chewing area when we smile, it's not seen, then this process tends to be delayed. So patients often neglect it, waiting for something, putting it off, and that's the tricky part. As soon as it becomes noticeable, they immediately want to do something about it, but as long as it's not visible to anyone. Yes, and only the patient knows about it, or as they say, they'll smile less, they'll open their mouth less, and no one will see it either. Well, let's say there's this aspect in terms of motivation, and that's where the median prosthetic comes in. It really allows the patient, let's say, especially certain patients, well, let's say not exactly public, but for people who often interact with others, yes, of course, temporarily replacing this defect allows them to communicate comfortably and chew without worry. And temporarily replacing this defect is also much cheaper, for example, compared to crowns or implants, but this solution exists and it's not something to dismiss. Especially, in particular, such patients come to us from remote areas and they understand what crowns are, or rather, they often realize the pros and cons of getting crowns, and they are already trying to replace it, let's say postponing it until their vacation. And let them come to, let's say, the mainland to restore their teeth properly. So I emphasize that this option exists, and the median prosthetic is for the butterfly prosthesis. It's temporary and it's removable, meaning it's truly removable. Sometimes it can pop out, which is also inconvenient. Of course, the fixation can be quite specific at times, but it's there regardless. And I emphasize aesthetically, we don't see anything. And most importantly, we have time. These are the moments that prevent us from having these irreversible phenomena that will then not allow us to go there. Basically, we can't place anything. Sometimes we can't even place implants, and we have to first address this issue orthodontically. So the orthodontists first shift the misaligned teeth, and only then do we move on to the rehabilitation protocol, which is of course very lengthy. So that's the second option. And now the most traditional option, of course, is implantation. That is implantation. This is indeed the most modern, the most advanced, the most correct way to solve the issue, because we immediately place the implant and wait literally 3 to 6 months. Maxim, we're placing the crown, so we won't touch the neighboring teeth, we won't let the adjacent teeth shift, and we won't lose any bone. So, of course, it again depends on how quickly the patient decides to start the implantation. But nevertheless, implantation. That's exactly what's great about it, that we preserve our neighboring teeth. We're doing well, we're placing them. Let's call it an artificial root, so we will refer to the implant as an artificial root. Yes, this is the future foundation. When we compare this to a house, it's like the foundation of a house. This is like the foundation on which the walls and roof will be built later, let's say. Yes, so implantation in this case is the most rational solution to the problem, and there's absolutely no need to be afraid of it. The procedure for a single implant takes 15 minutes, and it's really important for patients to understand that this isn't something we just call surgery. We prepare for it very carefully with sterile clothing and in sterile conditions. As a patient, you are in sterile clothing in a strong office. That's because, after all, it is a medical intervention, but the procedure itself, the implantation procedure, is similar to dental treatment. So sometimes the patient doesn't even realize what has happened. It's very quick. Especially with modern anesthesia, you really won't feel anything at all, especially if we're talking about a single implant. Believe me, that's just 15 minutes. So we installed everything, and in 3 to 6 months, you will have peace and quiet in this place. In some cases, by the way, if it is an aesthetically significant area, just when it is visible, that is, we can even temporarily, of course, it will be temporary, but we will put a temporary crown and you will leave even with a tooth in 2 to 3 days. That is, it can be done practically in a chair. So if there's such a need, let's say. So I tried to explain all 3 methods to you. I'm not insisting in any way. This is also very much the case. I would like you to hear me out. I'm not insisting on a particular method. I'm not saying that anything is bad or good. No, everyone has different conditions. Everyone has different starting points, different settlements, different doctors. So it's good when you live in a big city. It can offer that, so ultimately the decision is up to you, 100%. But I tried to highlight the main downsides, because this is a pressing issue, both for me and for us, as patients often ask these questions. Although it seems like there's a lot of information out there on this topic, it's important to understand this. And basically, these are the simplest basics. And I tried to compare it with you so that you could decide what to do with it. in a clinical case where we don't have one tooth. If you're planning on getting an implant and need a consultation or just some friendly advice, feel free to message us on WhatsApp using the link below or visit our website and leave a request. Subscribe to our channel, give us a thumbs up, and take care of yourself.